41. The nurse should assess for crackles in MI patients. True or false? Answer. True. Rationale. Crackles may indicate pulmonary edema from left ventricular dysfunction post-MI, requiring assessment, per AHA Clinical Evaluation Guidelines. 42. All MI patients experience ST segment elevation on ECG. True or false? Answer. False. Rationale. Only STEMI shows ST segment elevation, and STEMI may show ST depression or T-wave inversion, per AHA ECG classification. 43. Cardiac rehabilitation is recommended for all MI patients. True or false? Answer. True. Rationale. Cardiac rehabilitation improves functional capacity and reduces recurrent MI risk through exercise and education, per AHA Rehabilitation Guidelines. 44. The nurse should administer thrombolytics to MI patients with chest pain for over 12 hours. True or false? Answer. False. Rationale. Thrombolytics are most effective within 12 hours of symptom onset in STEMI. Beyond this, PCI or medical management is preferred, per AHA Reperfusion Guidelines. 45. MI can cause pericarditis as a complication. True or false? Answer. True. Rationale. Post-MI pericarditis, Dressler syndrome, can occur due to myocardial inflammation, typically 1 to 6 weeks post-MI, per AHA complications. 46. The nurse should monitor for hyperglycemia in MI patients. True or false? Answer. True. Rationale. Stress hyperglycemia is common in MI due to catecholamine release, requiring monitoring as it worsens outcomes, per AHA Metabolic Guidelines. 47. A sedentary lifestyle is a modifiable risk factor for MI. True or false? Answer. True. Rationale. A sedentary lifestyle promotes obesity and atherosclerosis, increasing MI risk. Regular exercise is preventive, per AHA Risk Factor Guidelines. 48. MI pain is always described as crushing or squeezing. True or false? Answer. False. Rationale. MI pain varies, described as pressure, burning, or aching, and may be atypical, e.g., epigastric discomfort, in some patients, per AHA Clinical Manifestations. 49. The nurse should teach MI patients to avoid smoking to prevent recurrence. True or false? Answer. True. Rationale. Smoking cessation reduces MI recurrence by decreasing atherosclerosis and thrombosis risk, a key patient education point, per AHA Prevention Guidelines. 50. Elevated troponin levels confirm MI within 30 minutes of symptom onset. True or false? Answer. False. Rationale. Troponin levels may not rise until 3 to 6 hours after MI onset, requiring serial testing for early diagnosis, per ACC biomarker standards. 51. The nurse should assess for pallor in MI patients. True or false? Answer. True. Rationale. Pallor is a common MI symptom due to reduced cardiac output and sympathetic activation, requiring assessment, per AHA Clinical Evaluation. 52. All MI patients require lifelong anticoagulant therapy. True or false? Answer. False. Rationale. Anticoagulants, e.g., heparin, are used acutely in MI. Lifelong therapy is indicated only for specific conditions, e.g., atrial fibrillation, per AHA Guidelines. 53. The circumflex artery occlusion can cause lateral wall MI. True or false? Answer. True. Rationale. The circumflex artery supplies the lateral left ventricle. Its occlusion causes lateral wall MI, seen as ST elevation in leads I, AVL, V5, V6, per AHA ECG criteria. 54. MI can be caused by coronary artery spasm. True or false? Answer. True. Rationale. Coronary artery spasm, variant angina, can cause transient ischemia leading to MI, though atherosclerosis is more common, per AHA Pathophysiology. 55. The nurse should monitor for hypotension after nitroglycerin administration. True or false? Answer. True. Rationale. Nitroglycerin can cause hypotension due to vasodilation, requiring BP monitoring post-administration, per AHA Pharmacologic Monitoring. 56. A family history of coronary artery disease increases MI risk. True or false? Answer. True rationale. A family history of premature coronary artery disease is a non-modifiable risk factor for MI due to genetic predisposition, per AHA risk factors. 57. The nurse should administer beta blockers to MI patients with severe asthma. True or false? Answer. False rationale. Beta blockers are contraindicated in severe asthma due to risk of bronchospasm. Alternative therapies are used, per AHA pharmacologic contraindications. 58. MI can cause mitral regurgitation as a complication. True or false? Answer. True rationale. Papillary muscle dysfunction or rupture post-MI can cause mitral regurgitation, leading to heart failure, per AHA complications. 59. The nurse should teach MI patients to follow a low-sodium diet. True or false? Answer. True rationale. A low-sodium diet reduces fluid retention and hypertension, preventing heart failure post-MI, per AHA dietary guidelines. 60. T-wave inversion on an ECG always indicates an acute MI. True or false? Answer. False rationale. T-wave inversion can indicate ischemia or NSTEMI, but is not specific to acute MI and may occur in other conditions, per AHA ECG criteria. 61. The nurse should assess for dyspnea in MI patients. True or false? Answer. True rationale. Dyspnea may indicate left ventricular failure or pulmonary edema post-MI, requiring assessment, per AHA clinical evaluation guidelines. 62. All MI patients experience chest pain as the primary symptom. True or false? Answer. False rationale. Some MI patients, especially women and the elderly, may present without chest pain, with symptoms like fatigue or nausea, per AHA clinical manifestations. 63. ACE inhibitors are prescribed post-MI to reduce ventricular remodeling. True or false? Answer. True rationale. ACE inhibitors, e.g., lisinopril, reduce afterload and ventricular remodeling, improving outcomes post-MI, per AHA pharmacologic guidelines. 64. The nurse should administer thrombolytics to MI patients with a history of hemorrhagic stroke. True or false? Answer. False rationale. Thrombolytics are contraindicated in patients with prior hemorrhagic stroke due to bleeding risk, per AHA reperfusion contraindications. 65. MI can cause ventricular septal rupture as a complication. True or false? Answer. True rationale. Ventricular septal rupture, a rare but serious MI complication, results from necrosis of the septum, causing a shunt, per AHA complications. 66. The nurse should teach MI patients to recognize symptoms of recurrent ischemia. True or false? Answer. True rationale. Educating patients to recognize recurrent chest pain or dyspnea ensures timely intervention to prevent further MI, per AHA patient education. 67. Obesity is a modifiable risk factor for MI. True or false? Answer. True rationale. Obesity contributes to atherosclerosis and hypertension, increasing MI risk. Weight loss is preventive, per AHA risk factor guidelines. 68. The nurse should administer morphine to MI patients with bradycardia. True or false? Answer. False rationale. Morphine can worsen bradycardia by increasing vagal tone. It is used for pain, not bradycardia, which may require atropine, per AHA protocols. 69. MI can cause right ventricular infarction. True or false? Answer. True rationale. Right ventricular infarction, often from right coronary artery occlusion, complicates inferior MI, causing hypotension, per AHA pathophysiology. 70. The nurse should monitor for elevated potassium levels post-MI. True or false? Answer. True rationale. Myocardial necrosis and medications, e.g., ACE inhibitors, can cause hyperkalemia post-MI, requiring monitoring per AHA metabolic guidelines. 71. The nurse should teach MI patients to take aspirin daily post-discharge. True or false? Answer. True rationale. Low-dose aspirin, 81 mg daily, is recommended post-MI to prevent recurrent thrombosis unless contraindicated, per AHA secondary prevention. 72. MI pain is always substernal in location. True or false? Answer. False rationale. MI pain may be substernal but can also be epigastric, jaw, or arm pain, varying by patient, per AHA clinical manifestations. 73. The nurse should assess for S3 heart sound in MI patients. True or false? Answer. True rationale. An S3 heart sound may indicate left ventricular dysfunction or heart failure post-MI, requiring assessment, per AHA clinical evaluation. 74. All MI patients require an implantable cardioverter-defibrillator, ICD. True or false? Answer. False rationale. ICDs are indicated for specific post-MI patients with reduced ejection fraction or high arrhythmia risk, not all, per AHA device guidelines. 75. The nurse should administer nitroglycerin to MI patients with ST depression. True or false? Answer. True rationale. Nitroglycerin is used for ischemia in STEMI, ST depression, to relieve chest pain, unless contraindicated per AHA emergency protocols. 76. MI can cause pulmonary edema as a complication. True or false? Answer. True rationale. Left ventricular failure post-MI can cause pulmonary edema, leading to dyspnea and crackles, per AHA complications. 77. The nurse should teach MI patients to avoid excessive caffeine intake. True or false? Answer. True rationale. Excessive caffeine can increase heart rate and blood pressure, stressing the heart post-MI, per AHA dietary guidelines. 78. A posterior wall MI is often caused by left anterior descending artery occlusion. True or false? Answer. False rationale. Posterior wall MI is typically caused by circumflex or right coronary artery occlusion, not the LAD, per AHA coronary anatomy. 79. The nurse should monitor for signs of bleeding in MI patients on heparin. True or false? Answer. True rationale. Heparin increases bleeding risk, requiring monitoring for signs like hematuria or gastrointestinal bleeding, per AHA anticoagulant monitoring. 80. MI can occur without coronary artery occlusion. True or false? Answer. True rationale. MI can result from non-occlusive causes like coronary spasm, demand ischemia, or microvascular dysfunction, per AHA pathophysiology.